Hello everyone. Welcome to my presentation. We're going to go ahead and get started. I'm going to talk to you about Charcot Foot. What is Charcot Foot? So it is a conditioning causing weakness in the bones of the foot and people who have significant nerve damage. The foot takes an abnormal shape identified as a rocker bottom appearance. Your toes may also curl. Your foot loses its shape. Your ankle can become twisted and unsteady, and the bones pressing against your shoes can cause opening of sores on your skin that can get infected. Okay. Um, Before I like to get started, let's talk a bit about the background. So the word Charcot comes from Jean-Martin Charcot, and he is the one who is recognized peripheral neuropathy can that led to neuropathic joints. Um, What else can we talk about him? So he is a French professor in the University of Paris back in 1982. He approached patients as if they were pathological specimens, and he observed them and measured them, and specifically in finding causes behind um, neuropathic joints and seeing, like, going down to the roots as to find out what it is that he can discover and why. Um, he also identified that the loss of sensation and pain perception that occurred in patients with arthropathies, resulting in continued weight bearing and stress of weakened joints, led to bone fractures, further destruction of the joint, and soft tissue, which clearly is what Charcot Foot is about. Another thing, tabes dorsalis is a loss of coordination and movement, especially with the result of syphilic infection of the spinal cord, which we'll get into a bit later. But tabes dorsalis is a French term coinciding with pied taboutique, and Charcot Foot is the English term for the tabes dorsalis. So etiology. So it is a result of neuropathy. It is decreases in sensation, ability to feel temperature, pain, or trauma. Um, the biggest thing is if in the early stages of Charcot foot, if there's hardly any sensation that you feel that your joints are being affected and causing pressure and against your tissue of your foot, that can lead to sores, and which can cause, everybody's walking, everybody's up and about daily. Walking is a part of our lives, so in the beginning, in our early stages, if we're constantly putting our weight and our pressure, that is can cause serious damage later on. um, because of the loss of feeling, the patient may continue to walk, and it's really difficult to then treat later on. Some signs and symptoms: we have warmth to the touch. The affected foot is obviously feels warmer than the other. There's a sign where there's redness in the foot. There's some swelling in the area. There's some pain and some soreness. And in the image here, we can totally identify where there's the bones, the joints are pushing down, causing a sore or ulcer, and there's leading to fractures and leading to the peripheral damage to the peripheral nervous system. So some physical therapy treatments, we have a series of removable casts over a total of 8 to 12 weeks. We also have crutches and knee walkers or wheelchairs are used to avoid putting any weight or affected foot. So because this is, at first you wouldn't, identify it. So when later on, once you're diagnosed with the Charcot foot, you are to have non-weight bearing to prevent from further damage. You are not non-weight bearing or partial weight bearing, depending if you're using crutches or knee walkers, or wheelchairs where you're simply not putting any weight. The goal is to not put any weight or standing on it, causing the joints to push further down. This device here is called Crow. It is a Charcot restrained orthotic walker. It is used to relieve any pain, to relieve any redness or swelling. That way you are not constantly putting weight or constantly feeling pain on the foot, the involved foot. Okay, we have some images here. I apologize if there's some of it might be a bit graphic, but it is something that we need to see and identify with, that it is what's possibly we might encounter in our careers one day, where we have to see patients with Charcot foot and treat and help them getting back to where they need to be. But I included these x-rays to not only show you the outside form, but the inside as well, where we have the joints pushing down here in on the right hand and on the left hand side, where we have the joints pushing down in comparison to the straight line we have here. And then we have in picture A, this is also obviously a sore caused from the pressure of the joints pushing down against the tissue, whether if you're wearing a shoe or not. We're also in comparison to picture B, where we see how the joints moved and how they cause the pressure, and it looks very painful, and nobody should go through it, right? But there's different reasons why. And there's also there's also Charcot foot surgeries. There's an option where there's reconstructive osteotomy, osteo osteo is osteotomy, osteotomy. So it is known as a realignment bone surgery. This procedure shortens or lengthens the bone in the foot or ankle to alter its alignment to ability to support the joints. So as we've seen in the earlier pictures, or the joints are not aligned together. So this really would help to get that straight foot again. And there's ankle fusion as well. We can see here on the image on the right side where there's some fusion of screws and rods or plates to lock the ankle joint to prohibit motion. There's exostectomy, where there's a removal of plantar prominences, which might cause ulcers to form. And there's the final choice that no one wants to go through, which is amputation and prosthetic fitting, but sometimes the option is having to do that if the infection has really gotten worse to the point where amputation is required. So here's some foot causes. There's diabetes. I mentioned that diabetes also is one of the main causes. The reason is why that it is a disorder in which the blood sugar levels are abnormally high because the body does not produce enough insulin to its needs. So stuff like that. Diabetes mellitus is what it's called. Leprosy, syringomyelia, my apologies. Parkinson's disease, infections, trauma or damage in the peripheral nerves. All these different kinds of can cause Charcot foot. And it's crazy because you'd only think that it's just, the constant. It's like a spinal cord injury or a spinal peripheral nerve injury, but there's also in addition to the causes. And here, lastly, we have some more pictures that can show you like ankle fusion in stabilizing, prohibiting motion, or we also see that the flattening of the foot. I'm pretty sure this is after a couple of months or weeks. We see here we have an ostectomy, and which is removing of the plantar prominences. We see the differences and in surgery, of course, and us as PTAs, we're able to help them getting back to their walking, and teaching them how to do gait in crutches and wheelchairs or walkers and things like that can help them getting back to their walking mobility. And that's it. That's all what I have for you guys today. I hope you learned something, and I hope and see you guys later on. How do we